Now we have Dr. Devisree Damodaran, JRF, Peripheral Pharmacovigilance Centre, Amrita.
So, എല്ലാവരും ക്ഷീണിച്ചോ ക്ലാസ്സൊക്കെ കേട്ട്? കുറച്ചേ ഉള്ളൂ. യുക്തിനെ കുറിച്ചിട്ടാണ് എൻ്റെ ക്ലാസ്. സോ ആപ്ലിക്കേഷൻ ഓഫ് യുക്തി ഇൻ കർമ്മസിദ്ധി. So these are the topics that I would be covering. So on to the introduction. So you have learned, like, through Aptopadesha you will get Jnana, and through Pratyaksha and Anumana you will get Vijnana. So now you have the knowledge with you, and Yukti is about the application of the knowledge that you have attained through Aptopadesha and Anumana and Pratyaksha. So Yukti is considered as the fourth pramana. Pramana means, pramana is nothing but it's a mean to attain knowledge. So Acharya considered Yukti as one of the pramanas, or one of the method to attain knowledge. So once you get your knowledge from Aptopadesha, Pratyaksha and Anumana, using Yukti you are going to apply it into the real world. Moving on to the word meaning of Yukti, Yuktistu Yojana Yatu Yujyade. So Yukti means Yojana. Can someone tell me what Yojana is? I hope all of you have learned this in your first year classes. So Yojana. Samyogam. Yeah, so bringing together is known as Yojana. നമ്മൾ കുറച്ച് കാര്യങ്ങളെ ഒരുമിച്ച് കൊണ്ടുവരുന്ന ഒരു പ്രോസസ്സിനെയാണ് യോജന എന്ന് പറയുന്നത്. സോ ഇൻ യുക്തി യോജന ഹാപ്പൻസ്. സോ അത് ഒന്നുകൂടെ ഡിഫൈൻ ചെയ്യുകയാണെങ്കിൽ, ലെറ്റ്സ് ലുക്ക് ഇൻ ടു ദിസ് ഡെഫിനിഷൻ വിച്ച് സേസ് ദാറ്റ് ബുദ്ധിം പശ്യതി യാ ഭാവാൻ ബഹുകാരണ യോഗജാൻ യുക്തി ത്രികാല സജ്ഞേയ ത്രിവർഗ സാധ്യതേയ. സോ ഹിയർ അവർ ഇൻ്റലക്ട് വിൽ ലുക്ക് ഇൻ ടു ഡിഫറെൻറ്റ് ഫാക്ടേഴ്സ്, ആൻഡ് ദ ഇൻ്റലക്ട് വിൽ ബ്രിങ് ടുഗെദർ ദ ഡിഫറെൻറ്റ് ഫാക്ടേഴ്സ്. And this bringing together of the factors will help us to attain knowledge in past, present and future. That is how Yukti works. So we can tell Yukti is nothing but analyzing the multiple factors and bringing it to a certain point so that it brings about an outcome. കുറച്ച് എക്സാമ്പിൾസ്, ഇത് ടെക്സ്റ്റുവൽ എക്സാമ്പിൾസ് തന്നെയാണ്. So let's see a few examples that defines what Yukti is. So the shloka is Jala Karshana Bija Ridu Samyogat Sasya Sambhavaha Yukti Shaddadu Samyogat Garbhanam Sambhavastada Madhya Mandhana Mandhana Samyogat Agni Sambhavaha Yukti Yukta Chadutpada Sambad Vyadi Nibarhani. So from these examples, you can understand what Yojana is. So when you go through the first line, you can understand when Jala, that is watering, Karshana, that is proper plowing, Bija, that is seed, and Ridu is season. When four these factors comes together in appropriate manner, it results in the production of Sasya, or a plant. So Yojana of these important factors will result in the manifestation of Sasya. And in second line it tells that Shaddadu Samyoga results in the Sambhava of Garbha. And in third line, when the Madhya Mandhanam Samyoga results in the manifestation of Agni. And again, a Yuktivat treatment comes into action when Bhishak Dravya, Ubasthada and Rogi comes together. So from this, the results are like Sasya, Garbha, then Agni, and lastly the Vyadi Nashana. So these results happens only by the combination of the multiple factors that are coming behind it. Did you get me? So whenever we need a production of a plant, we need that appropriate season, we need appropriate area for the cultivation of plant, we need the seed, and we need watering of the plant. when all these four factors comes together, it produces a karana. So understanding these supporting factors that are resulting in a karana is known as yukti. And bringing together of these four factors and understanding the karana is known as the process of yukti. So as I have told that multiple factors are there when we look at yukti, and these factors are known as hedus or karanas. So the synonyms for karanas or hedu that have been told in Madhava Nidana is nivitta, hedu, ayadana, pratyaya, uttana, karana. So these are the synonyms that is told for a cause or karana or hedu which result in a karya or an effect. So the causes or the hedu is known as, or the karana is known as a cause, and a karya is known as effect. So bringing together all these causes and understanding the karya is known as yukti. In Madhava Nidana, Acharya have explained different types of yukti, different types of karana or hedu. First one is Sannikrishta hedu, Viprakrishta hedu, Vyabhichara hedu, Pradhanika hedu. So to understand a karya, we should have a knowledge about this karana. So let's see what these individual hetus are. So Sannikrishta hetu is nothing but, it is an immediate or precipitating cause, and this factor causes the aggravation of doshas without undergoing the state of accumulation. See, for example, you are taking you are a person with like Vada, like you are a Vada Prakriti person and you are having a Krura Koshta. And if you are taking too much of Ruksha Dravya on the previous day, in the next day you will be having like constipation. So it is Sannikrishta Hedu, like it's an immediate cause for that constipation in your body. So that's a simple way of understanding. And next one is Viprakrishta Hedu. So in this, the Hedu will be a distant cause, so which does not produce a disease immediately, but it is accumulative and delayed effect produce a disease after a certain period of time. So എല്ലാവരും മറ്റേ ഋതുശോധനത്തെ കുറിച്ചൊക്കെ കേട്ടിട്ടുണ്ടോ? ഈ ക്ഷയപ്രകോപ പ്രശമങ്ങൾ. അപ്പോൾ ഇതാണ് ഇതിനൊരു എക്സാമ്പിൾ. ഇവിടെ when we look at this Viprakrishta Hetu, kapha is accumulated in Hemanta Ritu and it causes disease in Vasanta Ritu. So ഒരു ഡിസ്റ്റൻ്റ് ആയിട്ടുള്ളൊരു കോഴ്സ് കുറച്ച് കാലം കഴിയുമ്പോഴത്തേക്കും ഒരു ഡിസീസിനെ പ്രൊഡ്യൂസ് ചെയ്യുന്നതാണ് ഇവിടെ വിപ്രകൃഷ്ട ഹേതുവായിട്ട് നമ്മൾ കാണുന്നത്. നെക്സ്റ്റ് ഇസ് വ്യഭിചാര ഹേതു. So here വ്യഭിചാര is an inferior or a subordinate cause which is not enough to produce a disease independently, but it can precipitate disease under favorable condition. Example, consumption of unwholesome food alone is unable to initiate morbidity in a person who is naturally strong and doing a regular exercise. Next one is Pradhanika Hetu. So it is a prime and strong cause that shall bring sudden and intense morbidity. So for example, in Pradhanika Hetu, if some person is getting afflicted with poisoning, it may sometimes immediately results in the death or some other comorbidities. So that is the example for Pradhanika Hetu. Now let's move on to the difference between what Anumana and Yukti is. So in the previous class you learned that about Anumana, and now I am dealing with Yukti. So sometimes we might get confused. What would be the difference between this Anumana and Yukti? So in Anumana, Karya Karana Bandha is established in Anumana, but in this case, the Karya will be having only a single Karana. So when you see a fume, you will be inferring a fire. So the fire is the only cause that we are inferring for the production of Karana, which is known as fume. And again, when you see a fruit, you will be inferring that from a seed that particular fruit has arisen. So in this Karya Karana Bandha, the cause will be single and the effect will be single. So in Anumana, there will be only a single Karana. And moving on to Yukti, in Karya Karana Bandha, there will be multiple Karanas. So, if you remember the examples that I have given in the earlier slides, you can easily understand. I have explained that with proper irrigation, with proper land, seed, and favorable season only, a fruit get produced. So, these yojana or these coming together of these four factors result in the manifestation of a fruit, and that is known as Yukti. When we look at the application of Yukti, you can apply Yukti in your clinical diagnosis, in the treatment, and even in the selection of drug. So, in the clinic, in the classics, we have got these shlokas that telling the application of Yukti in the Shastra. So, the first shloka is Yoga Masamtiyo Vidya Deshakalopapadidam Purisham Purisham Vikshya Satneyo Vishaguttamaha. So, a Bishak can be told as Uttama. Uttama, when he do the treatment, the Bhishak is called as Uttama Bhishak when he do the treatment according with the Desha, Kala, etc. by proper Yojana. And again, in the second shloka it tells, Matra Kalashraya Yuktihi Siddhihi Yuktau Pradishtida. So, to attain a fruitful treatment, the Yojana of proper Matra and Kala, the proper application of the treatment according with Matra and Kala should be done. Then again, in the third shloka, it tells, Anena Ubadeshena Nana Aushadhau Bhudam Jagadi Kinjit Dravyam Ubalabhyade Tam Tam Yuktimartham Tam Tam Abhipretya. So, in this shloka, it tells that there is no single substance on earth which can be considered useless. So, every substance can be used in some or the other way when it is used wisely. So, from these three shlokas, we can understand the applications of yojana in the practice. So, now how to apply this yukti? So, in the first slide, I have told that yukti is attained through Bahukarana Yojana. So, we are collecting multiple factors and we are bringing it together and we are getting a result out of this. So, by collecting Bahukarana, we'll get an outcome. And how this Bahukarana Yojana is done is seen here. So, when you get multiple factors for an effect, you can categorize it into Pratikula and Anugula. So, the factors which are favoring to an effect and which are unfavorable to an effect. And by analyzing it, you can come to a conclusion. So, that is how you apply this yukti. And this particular process is applicable in nidana, in understanding the nidana of a disease. That is the cause of a disease. While coming to a treatment of a disease, you can understand this pratikula and anukula karyas, and you can do the yojana and you come to a final chikitsa. And again, while prescribing the hita ahara and vihara also, you can analyze these multiple factors that are anukula as well as pratikula for the droga as well as rogi, and you can prescribe it accordingly. And that's how that yojana occurs and finally resulting in an effect. So, now let's see an example for this yukti. Let's take COVID-19 as an example. So, can someone tell me what is the cause for COVID-19? COVID-19 cause. എല്ലാവർക്കും അറിയാം virus is the cause for COVID-19. So, when applying Yukti, we can do the yojana of the factors or the causative factors in this way. You can analyze which hetu or which like each causes of like each causative factor for causing the COVID into different kind of hetus, and you can come into a conclusion. So let's see. The COVID virus is considered as an immediate cause for this manifestation of the disease. You know, everyone get exposed to this COVID virus, but not everyone produce this particular disease. So from this, we can understand not only this immediate cause is a reason for production of COVID. Apart from that, few other factors are also resulting in the cause of COVID. So we look at the other factors or the other distant causes. We can see the underlying health conditions like obesity, diabetes, heart disease, etc. Can cause, the people with these kind of comorbidities are more vulnerable to get COVID-19. Again, like if a person is having a low immune system, the vulnerability of getting COVID-19 is more prominent. And again, the environmental factors and the factor like age, etc., could also result in the manifestation of COVID-19. So here we have come, like we are looking into different factors. The main factor which is causing the COVID-19 and the other accompanying factors that supports in the manifestation of COVID-19. So here what we are doing, we are finding out the factors and we are doing yojana of the factor, and we are coming to the conclusion about COVID-19. And again, when we come to the treatment of the COVID-19, we will be removing all these factors, like all these factor exposures from the patient, so that he will come out of the disease. So this is how the yojana happens while we look into the diagnosis of a treatment. So can someone tell some examples about application of this Yukti in treatment or some clinical diagnosis or something? How you do the yojana and how you apply it likewise? So in prameha, in the diabetes treatment, the diabetes HbA1c is a diagnostic test. If you are encountering a diabetes patient, so we will be giving a medicine for diabetes, and that like that even the prescription with that particular medicine alone won't be curing the disease. Along with the treatment, we need to give the proper regimen to be followed. We need to give him the proper diet to be followed. Like we ask them to take, like not to take sugar or any added sugar items. We ask them to do regular exercise and everything. So here, yojana is happening. We are looking into various factors that tend to produce diabetes or rise in sugar level in the body, and we are bringing it together, and we are giving appropriate advice to the patient so that you can control the diabetes in the patient. So whatever we do, like let it be like a clinical diagnosis. We are collecting different factors and we are coming to a conclusion. Or let it be chigilsa, like we are checking whether this particular chigilsa is applicable to that patient or not. And if it is applicable, we are collecting those chigilsas and we are applying it to the patient. And same way, the ahara vihara, like the diets and regimens that are good for the patient is taken in that particular condition, and it is applied to the patient, so we get the outcome, that is the cure of the disease. So that's how we apply Yukti in our Shastra. Manslayo. Okay. So can someone tell me like something about application of Yukti in PCOS? Most of you might know. PCOS, apart from medicines, what all things we can possibly give to the, or give advice to the patient? Definitely medicines will be given. Other than that, there are some other factors that can produce a better outcome if followed. Vyayamam, exactly. Vyayamam is a factor that a PCOS patient should always follow along with the medicines. And again, Yukti application comes in drug modification. You know, we have Kashaya, we have Gulika, Arishta, etc. So according to the logical application of the physician, he can modify this particular basic or these fundamental yogas into another formulation, another modification product, so that it so that the patient get benefits out of this. Because, you know, Kashaya is there. Kashaya, bottle Kashaya is there. So conversion of Kashaya is into tablets are, you can, it's there, it's available in the market. So based on the application of that Yukti in that particular formulation, we have converted it into another mode. So that's about Yukti. So I wish to conclude by telling that one cause can lead to many effects. And similarly, one effect can have a single cause. A single disease may have many causes, and many diseases may have multiple causes. So yojana of these causes, understanding it and giving appropriate therapy accordingly is known as Yukti. And also, you can apply this Yukti in, as Sir has already told, in Anukta Vyadhis as well. So you can collect the factors, that is, you can do the yojana of the factors, and you can apply it accordingly. Thank you.